Thanks for having us.
Whether you're in vet school or not, you might have heard the term gold standard. I just wanted to start out with kind of a definition. How would y'all define gold standard?
That's what you learn in vet school. Like it's having basically all the options and diagnostics and medications available to you. And maybe not all, there's always back ordered medications, but especially the diagnostics available to a pet and the owner, assuming that the owner can afford it.
Sometimes I like to think about it as per clinic. Gold standard at each clinic is going to be a little bit different. Like you said, some clinics might not have all the diagnostics that, a big teaching hospital might have. So even within clinics, gold standard can look a little bit different maybe. And I think it can kind of vary depending on the situation. Do you agree?
Yeah, I think so. I mean, you can have like our clinic, we don't have a CT machine. Our gold standard of baseline diagnostics is blood work, x-rays, physical exam, and communication with the owner of, okay, did we get enough information that we feel comfortable treating, or do you want to do the next step and have advanced diagnostics? And we are very lucky because we are 30 minutes away from a university who options available. But it's just like any other emergency clinic in the area or, across the country. Sometimes they're booked. Sometimes they're short staffed. And so even though they're close, it doesn't mean that they can get any and all animals in for a CT at any moment.
I think it's definitely something to keep in mind, or it's something that thinking about what's best for the animal. And it's always a really difficult decision to figure out what's best for the animal or best for yourself, and trying not to make a selfish decision, trying to prolong the animal's life if they're in pain or suffering, and trying to alleviate some of those things rather than doing what's maybe best for the animal and treating symptomatically and enjoying the time yet that they have left.
And I think just asking the owner, what are your goals? That's like if you diagnose cancer, or you're highly suspicious of cancer, if we confirm this, are you interested in a referral to further stage and grade the cancer? Are you interested in chemo? Are you interested in radiation? Is the goal as much comfort as long as possible? And I mean, I've been doing this for over 10 years now, and I can probably count maybe on one or two hands of how many people actually want to bring their dog for chemo and radiation. Now, in vet school on oncology, we saw patient after patient with radiation and chemo, and they were changing lives of tons of pets. But in the real world, very few people, at least in the clinics I've worked at, are equipped to jump to those options. So, I mean, a lot of people here, it's like, ooh, can I even afford an FNA? Where you're just looking at it under the microscope, let alone a biopsy. Because as the vet, we can take a FNA of an infected mass, but it's infected. And so, do you get results back? So, like in you're the vet communicating with these owners, like, okay, we spent some money. We sent off a small needle aspirate. Maybe we get a diagnosis, maybe we don't. Okay, so we get it back and yay, we confirmed XYZ. Or we need a bigger sample. Okay, now we're dealing with anesthesia or sedation and a biopsy. Well, at that point, why would I just take a biopsy if I could just take the whole mass or debulk it as much as possible if the pet's already going to be under anesthesia and if it's resectable. And $100 or $200 can make or break a procedure for most normal people. And so I've even heard some vets say, well, if you're not going to send it off, it's not worth taking off. And it's like, well, this draining mass that's affecting the dog's quality of life is worth taking off, and I see so many second opinions for my vet said my dog's too old to take this off. Like the old we can still try if it's licking it constantly, even if you don't want to send it off, even if you don't want to do chemo, can we improve its quality of life? And most of the time the answer is yes. Not every time. Just because they're not going to do the advanced diagnostics and like advanced testing doesn't mean that we can't make the dog more comfortable. Or the cat. Maybe the cow. I don't know. You haven't taken off a lot of masses on cows.
No.
A few, not many.
Well,
Yeah, I think it's interesting to talk about budget. I think when you talk about gold standard of care, of course, everybody wants to do gold standard of care as a vet. They want to recommend it. Start there, work your way down, whatever method you may use. And some owners may or may not be interested in it. Like you said, regardless of budget, sometimes chemo is not what somebody wants to do. That's not something they want to go through with. That's not in the cards for their dog. But regardless, budget comes up a lot. How often do you think finances influence your treatment recommendations versus do you just always start with that gold standard and then work your way down once they mention, I don't know if I'm, going to be able to do that, or how do you approach that?
Almost all day, every day that you're dealing with it. Eventually you get in a good, after you start knowing your clients, like there's certain ones that I'm like, I don't even need to ask. I know they're going to say yes to basically anything I say, which is awesome because we have that level of trust. But for the average client who walks in, I mean, they're wanting to know price on every little line item, which is appropriate. But as a veterinarian, the hard part is, so you're going over all your options and then you're making all these estimates and then you're going over the estimates, not let alone like examining the dog, treating the dog, like how much can you fit in like a 20 or 30-minute appointment? It's enough like a time, this runs into your time management as you're going over finances. But I mean, a lot of times I approach it very honestly, so I'm not wasting time and saying,
this is what I would do if it was my dog.
I do if they ask. If I don't know them well, I just say, what is the budget I'm working with? Because I don't want to just throw out all of these advanced things when I know it's not even in the cards for you. And so then in learning how to read people as you're talking about finances, and unfortunately as like students and like new vets, it does take time to learn that, but reading the room and not judging people because you never know who's willing to spend and who's not willing to spend. But
You can't make him feel like a terrible animal owner by not being able to afford certain things. But at the same time, you can't start too low for the people that are willing or want to do anything and everything they can. So that's certainly hard to find that balance.
Yeah, I've met people who have taken out sizable loans to, get their dog hair because that's just what they wanted to do. That is the option that they wanted to take. They were willing to sacrifice whatever it took financially. I think pet insurance helps sometimes, just depending on the situation. I know it's getting more popular,
my
but
opinions, yeah.
do you think it's made a difference?
Well, no, I think it can help in the right situation, but it
They're making it harder to get things approved for insurance claims.
That's another good point. Yeah, I think the idea of pet insurance is nice because you're like, okay, well, now when my pet gets sick, I pay this monthly bill. It's like human insurance. I'm going to go in, I'm going to be able to get what I need. But the bigger it's getting and the more corporate it's getting, I think it's getting harder and harder to get stuff approved. Like you said, just like human med, send it back. You already spent this money. It's a reimbursement model. And you're like, I thought this was going to be covered. Why is this not covered? So then you still have to think about it
you're
even when you have pet insurance.
yeah. And the other thing to think about, people are like, "Oh, I have insurance. I can just pay later." It's like, well, no, we still
Pay
need
now.
paid today, but your insurance company, and you can figure that out on your own time, and it's minor, but there is some extra office work from support staff and record keeping and emails back and forth. Like the more people who are using it does take a little bit more work to get everything submitted and emails back and forth. And so yeah, like in human offices, they have just offices of people who communicate back and forth with these companies, but we don't have that. So it's just one more thing to have. And I feel like you have to be really careful when you're typing their records because they'll take one thing and like twist and be like denied. But I've had some great outcomes and then some unexpected outcomes. So it's not foolproof for sure with insurance companies. I've always been a very grounded in my career prior to vet school. Grew up in a farm, worked in multiple rural practices prior to vet school for years. I mean, I've been doing this for a long, long time. So, and I know everyone's journey is different, but I already kind of had somewhat of an established mindset of standard of care from the start. And I feel like I had like an unfair advantage. It's something that a lot of people struggle with. And we deal with a lot of not residents, vet students for internships and preceptorships. And sometimes like my mind is blown of the not having the understanding of the real world and only gold standard, which again, gold standard is wonderful if owners can afford it and like awesome. I'm not knocking that. We can do amazing things now, but it's just not what everyone can do. It's what very few people can actually do. So I don't know. I had an unfair advantage when I started. I worked at a mixed animal practice with 5 vets, no techs, no assistants. Me, the owner, I did farm calls by myself. Owners held for every blood draw. I did everything on surgeries from start to finish with sometimes they'd help me like lift it on the table. And I'm not saying that was perfect, right? But it molded me very quickly to be flexible and do the absolute best I could with what I had. This was a very spectrum of cares came very easy for me.
I feel like I always use the example when I've talked about it in the past, like, oh, well, back home, we didn't have access to this. I use the example, my dog needed chemo, and I'm not sure if we would have done it anyway, but it was 4 hours away. Forget the cost, it's 4 hours away. There are some things that in rural areas are not accessible, whether it be because of finances or because of geography or because of that clinic's capabilities, like what they have there. And I don't know, I feel that there's a lot of guilt either on the vet side and from the client side of I want to do the best, but again, for whichever reason, it's not really an option. It's not feasible. How do we explain gold standard care or the top of it without making them feel pressured? You mentioned you kind of have to read the room. Sometimes, do you ever run into something where it's like you can tell they want to do the most, but you don't want to pressure them into exerting themselves and making that 4-hour drive? I think maybe it was every week or whatever it might be. How do you approach those
But
situations?
yeah, it depends on the patient. Gosh. I think my try to do is just be honest with owners because realistically, after you've seen some of these things over and over and over again, you can predict most likely outcomes ish. And so I one of my lines with owners is, hey, even if you can afford this and you can do all the diagnostics, is this still treatable? So did we put this dog through testing, through traveling, through nervousness, through sedation to get the tests, and we confirmed it's bad, and now we're nowhere closer to getting comfort in the dog. And so that's where I'm really realistic. Again, we're lucky because the teaching hospital is so close, but still just 30 minutes away. clients will be like, well, I'm not driving 30 minutes. So it's like, well, that's the option if you want these tests kind of thing.
I'm interested to learn more about the large animal side of things. Is there ever a whole lot of debate over this gold standard thing, or is this more of a small animal issue?
It's a little, I guess, certainly more of a small animal issue that I do run into some cases where clients may have really valuable animals, or they're more of a pet rather than kind of what we were talking about earlier with most livestock are part of a farm and a business where those animals have a more a certain value. And if a treatment or procedure is going to exceed their value or ability to return on investment of that treatment sale. And so, no, I really don't run into that question very often. Every once in a while, I run into or have some clients with super valuable animals that will do everything that they can to keep that animal in production or to keep them more comfortable. But no, it's pretty rare and uncommon that I run across some of these issues that are more common in the small animal world.
Would say not that often. Now you hear those stories quite frequently, but that's not the absolute norm. But we remember the worst of the worst. I euthanized 2 animals today. Super sad. I was super down about it. They just sucked. And those owners thanked me profusely. Now you forget about that. I know, I like want to tear up just thinking about it. And I'm sitting there thinking like, oh my gosh, I couldn't save your animal. And profusely thanked me for doing such a good job. And I'm sitting there like, I don't feel like I did. So I do think we need to really not, it's so hard, but not focus on all the bad comments because maybe there were good comments too, but it's the bad ones that stay top of mind. And then another thing to keep in mind is we're dealing with people's family members, their pets, who they love in finances. And they're stressed, they're scared, they probably don't have any money, and they're desperate. And so we deal with people on their really, really bad days. So can we just give some people some grace sometimes and not just assume they're horrible? Again, there's bad people out there, but most people are good. And I think we need to do a better job at focusing on that.
I was reading the cards that people write this one clinic I was externing at after euthanizing their pet. And I feel like the owners that go out of their way to thank us, it's part of the job, you know? And I would never expect somebody to say thank you after doing it. But when we read the cards of the people who genuinely feel that strongly about it and are so grateful, it's like reminds you why you're doing that in the first place and the relief that you're providing for the pet and the family, you know?
And the family, we can't forget about the family, right? Like everyone has lots of bills right now, and we know veterinary medicine is not getting cheaper and people are struggling. So, yeah, I think remembering the people aspect. I know our focus should be the animal, but if the owners can't afford food for themselves or their dog, maybe they shouldn't be doing chemo on their pet, you know?
Yeah, I think it just always puts it back into perspective, if you will.
One of the things that we probably get complimented on the most at our clinic is for euthanizing our process and care that we provide euthanizing
End
animals.
of life care.
Yeah, I was gonna say it also makes a difference in how you do it. I've been to clinics who do something that I don't know why, but it was literally life-changing when I saw somebody do it. I was like, "I will always be doing this as long as the owner's okay with it," and you know, before euthanasia is doing, the last kiss, the little Hershey's kiss.
We just started doing that.
Isn't it the sweetest thing in the
Yeah.
world? Every time I do it, I tear up. I don't know why. And it was something that I saw on an externship right before Christmas, right before I went home and put my dog down. And I got to give him his, and it was like, or like decorating the little IV catheter bandage, or things like, I don't know if y'all have seen the company Youth bags, the more dignified kind of body bags. I love that we're making an effort to make it a more dignified experience overall.
Yeah.
And I think it's important to remind pet owners, because I get it as a vet student a lot. So, I mean, I don't know what y'all are doing in practice, but when people find out that we're choosing to go into this field, maybe it's different once you're actually in it and it's like, ah, they're too late. But I get it a lot where they're like, I could just never euthanize animals. I don't know how you do it. And it's like, but I didn't go into this to do that. I'm glad to. It's a vital part of our job, I feel. But it's not that I go into work every day excited to do that, or that I look forward to putting somebody's animal down. It's part of the job. Nobody enjoys doing it. And I think sometimes pet parents think that it's what we jump to, or that we always recommend it if they can't do XYZ. And I don't know. I think it's important to remind people that we're here to do the absolute best for your pet and you. So whatever that option might be, you know?
That's definitely something that's a little different when with large animal that's selling that animal or sending it to market is oftentimes a very viable treatment option. And that's what's much different than working with the companion animals. Those my patients have a oftentimes have a set value. I primarily work with cattle. They're very valuable right now, even to any type of those animals to take to market to sell. You can still recoup or gain a lot of value, even in an old cow that has a bad foot.
Yeah, well,
She's probably not worth treating. Send her on, buy a new heifer next year.
yeah. We were just talking about that. My family has cattle, and my family got into ranching later in life. And so we always come at it from a different perspective. Sometimes they are still our pets, even though they're not. So we might do things a little bit differently, but we are always so appreciative when the vet is like, let's be realistic here. Like, if you're doing this as a business, let's talk about what treatment's going to cost versus what you spent or what you're able to gain on this. And a lot of times when the vet has recommended it, we end up making more money on that animal, and the animal's, better off than if we had tried to treat and extended that and just drug it out. And it's better for the rancher, it's better for the animal. Large animal is just so vastly different with all of these conversations. It's interesting to compare the two and think, we don't, other than horses, you don't really talk about euthanizing cattle a lot. It's mostly sale barn before things get to that point?
I think the one thing you have to keep in mind with sale barn and going for slaughter with your large animals, obviously your like food withholds, making sure we have those conversations before they get sent and before the owner puts antibiotics in the cow. Like, can the cow live for 31 more days or 28 more days to get the withhold out of the cow? And it's like, wow, you gave that shot. Now you can't sell her for a month, keeping those things in mind. But my first job, I worked with a lot of dairy cows. And so not only beef or like meat withhold, but milk withhold. And there were some places where we had like I euthanized cows. It's not nearly as common as like the horses and small pets, but it is still not an easy part of putting cows down anyways. And then we'll see not getting anything for them too if they die.
I don't have to have that conversation or that thought process very often. I'd say most of my clients and farmers are very responsible and care for their animals, wanting wanting the best outcome for those animals.
I have never personally seen somebody that's intentionally done something disregarding some random abuse cases from necropsy. I've never seen somebody intentionally do something. If anything, I think a lot of it comes from a place of not knowing. And I think I get very frustrated when I see pet owners come in that have no idea. And it's a difference between somebody who's been told the same thing over and over and doesn't want to listen. Okay, that's one situation. But if you have a new client and I don't know, maybe they have fleas and they're not on flea prevention, I think it's super simple to just say, okay, like, do you know what flea prevention, how it works? Or are you interested in learning more? Something so simple that might take 30 seconds and really change that pet's quality of life. Not because the owner was purposefully not providing that care, but maybe they didn't understand the importance or they didn't understand. I had somebody ask, "Oh, are fleas year round?" And then that's my chance to kind of explain and say, "Yeah, they are year round, especially in Texas where it doesn't get that cold. And they don't necessarily die. So it was the winter time. So yeah, we do still unfortunately need to do prevention in the winter. But now that pet is on prevention." And it was super simple. It was like a 1-minute conversation. And I think over and over again, I see uninformed or misinformed pet parents and vets that are tired of explaining the same thing over and over and over because there are people who don't want to hear it. You know what I mean? And it's hard to say the same thing over and over and nobody's heeding that advice and nobody's listening. I'm just using prevention as an example, but you can tell people over and over and over, and they're not going to care until their dog gets heartburn or until their dog has something go wrong. Or, oh my gosh, there's fleas in my bed. Well, we talked about this. I talked to you about this. But I don't think a lot of people understand until it happens to them. And sometimes that's what it takes. But if you can do 1 minute of proactive, hey, have you heard about this? Can I tell you about this? And see if it makes a difference, it's always worth it in my mind.
Well, and fleas are a huge deal, right? Because like if you can prevent the fleas and then you can prevent the skin infection and that not all dogs get, but if you're allergic to them, like if you tell them you're going to save money if you just get one of these pills once a month and you don't have to keep coming in for all of this additional treatment. And it's funny that you brought up fleas. So I'm going to tell you some tricks that I do because it's called flea nile. So denial, flea nile. And there's lots of different new remedies for fleas and, owners are just doing the best they can, but they'll be like, well, I use this flea medicine and it's working. And so I actually have little tiny bags and when I find a flea, oh, it's great because if I can catch it and put it in the bag, I will literally tell the owner, well, why don't you bring this home and see if it dies? And if it doesn't die, I mean, I guess eventually it dies, it's in a bag, but when you actually put it in a bag and show them like this flea is thriving on your pet, sometimes they don't even know that they're there and they just say, no, it doesn't, I don't see them. So it just takes finding one and proving it. And like if you can just show them, they're going to listen to you. But there is a real concern right now with like the seizures and the side effects of oral flea and tick meds. And we can't just value that because that's a whole nother spectrum of care, right? Because people sometimes are more comfortable than others with different treatments. And that's where we have to provide options for these people because yes, it's very uncommon, but sometimes occasionally there might be a neurologic effect with an oral flea and tick pill. So what options do we have for those owners that had one bad experience one time a long, long time ago? And I get it, right? Like what if that was your pet? I would be scared. So like what else can we offer them? Can we offer them a Seresto collar? Seresto collars still work really well and it's not oral. It's not near as scary. You can take it right off if it's negatively affecting the pet. And we all know in the vet world that our topicals aren't quite as good anymore. Your front lines and your advantages. I mean, that's pretty common sense, but they can be effective, just not as good as the pills. But maybe we do it every 3 weeks instead of every 4 weeks and still get good control on your pet or better control than nothing. If they absolutely refuse to buy the pill, because you don't want people to feel bad. And you still, like, I think most of the time, if you can just provide options, you're not likely to have an angry client. So that's Fleas are a good one. I mean, that's every day. Every day you're going to be talking about fleas.
I was at a clinic here in Louisiana, and there was a day that I saw every single patient but 2 had fleas. And it none of the owners were intentionally giving their dog fleas. Like, we never approach it. We don't think you gave your dog fleas or that you would want them to get fleas, because I think some owners react differently and they're like, "Oh, I would never, like, what?" And we're like, "We didn't say you did, but, like, let's treat it, let's get it fixed, and let's prevent it from happening again. Let's talk
Yeah.
about it."
And I tell them, hey, this is a good thing. Of all the skin
True.
deals that we deal with, I can handle fleas. I can get rid of those. We can have a game plan and the dog can go on with its life. Again, if it's just the fleas and not, I mean, in Missouri, man, I don't know about you guys, but the allergies are just horrendous with itchy dogs here. So most of the time, if they are allergic to fleas, they're allergic to all kinds of things. But sometimes it can just be the fleas. So I tell people it's a good thing when I find them because I can fix it.
That is true. Easy solution. No hydrolyzed diets here. Nothing crazy. Yeah. Do you have any sort of like little script or prompt for discussing multiple treatment options? Communication can be hard for some people.
I think it's very fair to start, especially if you don't know the client very well, is can we just talk about what budget we're working with? Because I want to provide you with appropriate options that can help your pet, but that you're comfortable with. And so if you just approach it with like, what are we comfortable with? And then I go from there because I can say, well, at our clinic, this is what I can provide here. And I mean, there's plenty of times where, yes, I can do blood work or x-rays, and it's one or the other because they cannot afford both. And we charge like a 1 view versus a 3 view. So I tell owners, I'm like, if I think it has a spleen mass, sometimes 1 view, you're done. And if the dog is pale, has a high heart rate, the owner says absolutely not going to surgery. Do you need to do blood work? Do you need to do all 3 views? Do you already confirm the mass is there? So yes, you can keep going with diagnostics. So I usually tell owners, I'm like, well, let's start with one or the other and I'll take it step by step. And if I find the answer, I'm going to stop and I'm not going to keep going and I'm going to call you. They really like the transparency because so many people are used to dropping their dog off and no matter what, full blood work, full x-rays, full everything. And it's like, well, did we need to do all that? Now, this all comes from like a practical human being vet. This isn't the best for business ownership. Like sometimes Neal has to remind me of that. The other thing, and this is like for me, just a hematocrit can tell you a lot about a dog and people decline blood work, but maybe my tech already put the blood in a tube when we're like, oh, don't run it. They declined it. Well, if you spin it down and just look at it, I can basically tell you the hematocrit of the dog. And then I have Neal
Yeah,
saying, so free diagnostics. But I mean, like sometimes you just got to do what you got to do to help people.
The other done my OSCE on PCV and running, little hematocrit and whatnot. And I had never seen that done in person. I was like, do people do that? And I was at a clinic recently that ran one for goats almost every day because it was just so
Yeah.
cheap. And it's like, well, it has a hematocrit of 6. So let's talk about it. I watched 2 blood transfusions and I was like, I didn't even realize people were doing this, just day to day. So that was definitely interesting. I think like ear cytologies, depending on the clinic, some charge more than others, FNAs, things that can tell you a lot of information or have the capability to tell you a lot of information, not guaranteed, right? But maybe starting there and being able to tell somebody when you think about an FNA, if you think it's a lipoma, and then just checking it, like, oh my gosh, we just saved so much money. Or if they're not going to remove it, saved a surgery bill. You know what I mean? Working with those options is always interesting to start learning about. I didn't have a lot of clinic experience before vet school. So getting in and getting out to all these externships and seeing how different doctors in different clinics do every single little thing and approach it differently. And I like some more than others. Owners like some more than others. I'm like, wow, there are genuinely so many options that even if they tell you about in school, it might not be the first thing you reach for. But once you see somebody do it and you're like, that's such a new way to approach it. Is there anything that y'all saw either at old practices or old rotations that you just still take with you and do to this day?
I mean, the hematocrit one is a huge one for me because my very first clinic, again, they did not have in-house blood work at all. All it was a little tiny PCV machine. And so, I mean, I learned to utilize that machine to its fullest. Not that we didn't send stuff off, but like in the rural clinic, getting it to the lab and getting results back, like everything is so instant now. But just 10 years ago, it wasn't. And so you had to do the best you could with what you had. And so I've definitely carried that with me of, hey, if we have the blood, can you just spit it in the tube? I can just look at it. And is the serum yellow? Okay, crap. Let's talk about that. Is it icteric? Is it hemolysis? How low is the red count? How high is the red count? Okay, we can't push near as many fluids on this one. The red count's low. Oh, we can push it harder on this one. The red count's high. So I guess that's my oldie but goodie realistic trick. You know how many heartworms? Did you guys know when you spin down a blood tube, a hematocrit tube, all of your heartworms go into the buffy coat? Have you heard this? So you bring that little PCB tube over to the microscope, wait 5 to 10 seconds, put the buffy coat right under the microscope, and you will see the microfilarias swim out. Done.
I would describe them as more like, I don't even think they do surgery, like strict GP. And I want to say that they operate more gold standard or whatever. And then they did that. And I was like, wait, y'all are doing this? Like, I think they had run a heartworm test and then done that to see if there were microfilaria in the blood at that point. And I was just like, what?
Well, if
Am I not
people
Well, what do you think the doctors did? I'm just
so
making
true?
stuff 30
Yeah.
years ago when we didn't have the SNAP test that we have now. I mean, we think of that as the gold standard, but heartworms were around long before those SNAP
yeah.
tests that we have.
That is true. I think even me myself, I've become so, I wasn't around 30 years ago, I'm 20, 21. Like, I don't even think about what it was before. All you see is what you go into now. And you're like, how did you do that before XYZ? How did you do this before IDEX spit out your blood chemistry in 10 minutes? Like, do you call them back tomorrow? We don't even think about these things anymore.
Yeah, it's crazy. I mean, and heartworm tests specifically, right? If you're dealing with a bunch of positives or not so much, but plenty of people, even in the heartworm endemic areas, still decline the heartworm test and say we had to do a CBC or something. You're like, well, I diagnosed heartworms and you didn't even pay for the test, like I don't know. But these, yeah. And again, not saying doing all the things is bad. It's not, but we just gotta help people because if they're declining your options constantly and not getting any care at all because they can't afford all these diagnostics prior to a surgery, but then again, it's like as long as they know the risks and the complications and communicating that. And I mean, most people are just honest, good people that realistically want the best for their pet and they still want to be able to put food on their own table. And so they want to know their options and they don't want to feel judged for not choosing all of the things. And so, and I do, it hurts my heart when I have clients come in and they're like, well, my last vet made me feel like crap because I didn't do X, Y, or Z. And it's like, I hate that. I hate that. Like, yes, those are options, but here are other options. And maybe the other option is euthanasia, or maybe we are dealing with end of life care, and that's okay. Like, as long as we have a plan and we've communicated, again, people just want options. They don't want to be like, this is the only thing that we can do.
One other thing to keep in mind when talking to clients and trying to communicate about prices and value is that procedure A, I think of a good example is at one clinic is not necessarily the same thing that's happening for the same procedure at another clinic, the client may think it's the same, but a dental at one clinic that costs $300 is probably a different level of care than the same dental that the client thinks it's the same at another clinic for $800. But the level of care is different. And those are kind of shoppable things that people call around and get quotes, and I think somebody's just trying to rip them off. But the level of care is different.
Yeah.
Yeah, we had a question written down somewhere here about, is there a good way or a good way to think about communicating value versus price or cost? In order to do it, you almost have to be asked, like, well, why is it this much? And then you can kind of get into, well, this is what you're paying for. You're paying for these things to be run. For example, if you give somebody a price, $500 for a spay, well, so-and-so clinic can do it for 150. Right. So our price includes, maybe it includes the blood work. Maybe it includes so-and-so. So do you ever go through and just explain value of these things? This test can tell us this. This test can tell us that.
The best you can. And that's the other hard part is like the time management of like it's still a business. And the longer you take like explaining all of these things to a person over the phone that may or may not actually schedule it, like that it is hard, but I mean the goal, and we're not perfect, but having scripts for your employees. So like, our dental, which includes this, and this, and more of a line item helps people understand. But the other thing, and I'm not knocking anyone. Again, I've worked in like all kinds of standards of care, but just like the monitoring equipment. So again, my very first job, it was injectable anesthesia. I was doing the surgery. I was monitoring. It was breathing. It was good. It had nothing hooked up. It probably wasn't intubated. Maybe I stuck a mask on it if it got light. And so if they're shopping that clinic's spay for a different clinic's spay who has an IV catheter, who's intubated, who has an RVT monitoring them, who's getting post-op pain care, who's getting the e-collar, I'm not knocking, like, there's plenty of places that don't do all the things. Think about where with the spay and neuter clinics that are just kind of cranking them out. There's plenty of people still doing it like that and still having good outcomes, but it's not the same. It's not the same cost on the back end, and clients don't know that. And you also don't want to throw anyone under the bus either, right? You don't want to be like, well, they suck, because that is not the goal either. Now, one thing when we first opened and we were a little bit slower, I did a lot more social media, like, let me show you my surgery room. This is what I have, and this is why. This, blah, 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 blah. And really was transparent with clients, like, this is what you're paying for with your spay. Some places, again, where I was, there wasn't a monitor at all. But other places just have your SpO2 monitor and not your CO2. Well, your SpO2 is the last thing to change, right? I RBT a routine cat spay coded on the table. She caught it with a drop in the CO2, started CPR. We got that cat back, finished the spay, woke it up. Super impressive. And like that wouldn't have happened if it didn't have a catheter, if it wasn't intubated, if that human wasn't the human watching the cat. Now, that's happened to me once in 5 years. I've had one or two others that, something weird happens during surgery. It's not the norm, but
That's the thing
that's
with
what you're paid for,
a lot of
right?
these, if you want to call them extras of some of these procedures or even some of the diagnostics are not necessary, certainly not necessary all the time. They're a safeguard for when something does go wrong. If something crashes during surgery or needs an immediate injection, you've already got the IV in, you can pump something to save that animal's life in the event that something goes wrong or something unexpected happens, not necessarily something goes wrong.
Yeah, it's a hard balance to explain that to owners, and you just do the best you can. And once you start getting a client base, they're going to feel more comfortable with you. And I don't know, I just am as transparent as possible of this is what I have to offer. I don't know what the competition offers, but you're welcome to investigate. And if you choose us, awesome. I just got the goosebumps because I'm so passionate about this because, I mean, gosh dang, how many animals are we putting down that don't need to be put down just because all they needed to be told was call your local vet in the morning? Isn't that wild? Not every time. There's plenty of animals that come in critical where it just needs to be ended, and that's fine. In my head, think of so many examples of like, well, I brought it here last night. They really pushed euthanasia, but I just didn't think it was right. And so they show up at my doorstep and they're like, "What can you do?" And I'm like, "Well, here's your options. Let's try this. Do some supportive care. Give it 24 hours. Is it stable? Cool. Continue. Is it okay, let's have this conversation. Is it improving? Cool. Let's continue." Just and you always have to remember, even though it's like a gold standard facility, a university, or an emergency center, and they have all the things, you may still be dealing with a vet who's been a vet for 6 months, even though you're at the the fancy place. And so, I mean, I'm at the point where I'm pretty comfortable telling people what I can and cannot do and what's worth trying. And one of my big examples is blocked cats. How many people have seen blocked cats be put down? Refer, refer, refer. The average human can't afford referral for a blocked cat. And they just can't. I haven't worked in an emergency clinic since vet school, but there's always blocked cats there, right? And those are the ones that people consent to treatment. Think about all the ones that don't make it to treatment. And I still have an occasional bad outcome with them because they're critical patients, right? But you tell the owner that up front. It's like, hey, I am willing to try. I feel like I have a great success rate with these blocked cats, but are they critical? Yes. Could they die? Yes. But are we giving them a chance? Yes. I think any GP clinic can hospitalize a blocked cat. Now, realistically, if it's hitting the weekend and we're gone, and again, like we're in a rural area where, I mean, sometimes you have to do some after hours care. That's just part of the job. And in my perspective, I realize that not everyone's willing to do that, but I like what I do and I like helping animals. And if it means that I'm going to come in after hours for a blocked cat and I'm bringing income for my clinic that I wouldn't have had, I'm gonna do it. Now, if we're gone for the weekend and I can't care for it, maybe I have it catheterized for a few days and I'm just honest with the owner. Hey, the urine is still really bloody. I have to leave. Do you want to transfer to an overnight facility for a day? Give it one more day. And I've done 80% of the work and they're just monitoring it. Or, hey, we're home for the weekend. We're at the clinic every day anyways. I'll come and check your cat. Like, it is harder now with kids, right? Because now you're like getting kids in bed and they're getting up in the middle of the night, and it's harder to get up in the middle of the night now for one more thing. But man, anyone can treat a blocked cat. Now, if I had a stone stuck that I could not get Bud to budge, yes. And have I had to put some down? Yes. But that's my big example of, man, give them a chance. Decompress them, pull out some urine, stabilize them, get them fluids, get them pain control. Call your RDVM in the morning if it's 10 o'clock at night. That's easy. That's pretty normal things. Again, if your RDVM is willing to see them, and a lot of us are at capacity, but as a small business owner, it's hard for me to turn away business. One thing that I feel is very powerful when we talk with vet students is I say, raise your hand right now if you can spend 5 to 10 grand on your pet. I mean, the average vet student is going to be like, nope. Not that you wouldn't do absolutely everything that you could and start selling your belongings for your pet. But yes, a few people might be able to just drop 10 grand on a foreign body surgery. But realistically, I'm like, you guys need to remember, in 1 to 4 years or whenever you graduate, you might be telling the next person, I can fix your dog with this much money. And we have to get back to giving options when at all possible. That's not always the option. If it's a clear foreign body and the dog needs surgery, it needs surgery. But maybe instead of doing it at 2 a.m. at the ER, a little bit of fluids, start some antibiotics. Maybe if you're worried about infection, some pain control, go to your RDVM in the morning where it's half the price. Like, I don't think that's wrong versus euthanizing. But how many foreign body dogs? We have such a good relationship with a lot of students in the area, and they'll text us after hours on the weekends. Hey, can you do a foreign body? They're going to get put down here. And maybe it's yes, maybe it's no. Like it just depends if we're available or how stable the dog is. We have students like trying to be sneaky so they're not getting in trouble, but they're trying to save the pet. Like, should we be teaching that? Like, I don't know. Or should we be teaching options? One One thing that's going to change our industry is AI. Because now, like, even poison control, people will be like, I don't want to pay that. And it's like, well, it's better than an ER visit if you find out you don't have to go. But now people are just sticking it in AI and they're like, that's good enough. I feel good about that. And it's like, well, I don't know that source. I can't speak to that source, but I think it's getting pretty smart, like, yeah, I'm a little concerned about poison control as a long-term business model. Yeah, we have a social media page it's called Neal and Angela the Vets. So it's not necessarily like country vets or clinic, but it's like Neal and Angela surviving daily life as business owners and raising three young children. And we're pretty transparent on there. Now we're very busy. So sometimes there's a lot of posts and then sometimes it goes down a little bit. Sometimes there's a lot of stories and sometimes it just depends on time. I'm really passionate about bringing positivity to this industry because raise your hand if you have a negative classmate or a negative vet mentor. And I hate that. Not that I can't be negative some days I have bad days, but I do think positivity comes from like your leaders, your vets, your managers, and stuff like that. So, anyways, like on our page, I really try to be positive, but I do try to be realistic of like, whoa, today sucked. Like, or, like I'm a mom surrounded by piles of dishes and dirty clothes and surviving after hours. It's not all beautiful as you see on social media. It's not all perfect, but it's really hard, but it's great, without speaking negatively about the industry because we all have a lot going on, no matter what industry you're in, right? So I think we just need to be more transparent and I think we do a good job. And Neil personally, he loves dancing in the videos. Just kidding.
I know, now I need to go look at the profile and check it out.
Yeah, yeah. If you're looking for dancing, you'll probably be looking for a while, but
I know we're gonna have to go digging. We'll figure it out and then, re-tag or repost. I'm just
yeah.
kidding. Anyway, on that note of positivity, we feel the exact same way. We try to end off all of our episodes by asking y'all, what has brought you joy today?
We definitely like sharing our experience and sharing our journey, hoping to inspire future veterinarians and other people in the industry.
I agree. That was being asked to be on this was great. Like I love spreading a different side or a different perspective of veterinary medicine because yes, the gold standard and all of the specialty things that we're learning that are amazing, which they truly are amazing. But man, it's not always the most practical for the normal human being. And I just want people to know that that's okay and that we could just share this information and promote small business ownership and family ownership of vet clinics and it can be done. It's hard, but it can be done.
I was gonna say it's getting harder and harder to do that, so I'm sure we all appreciate what y'all contribute to the industry. For sure. It's getting harder to find, to be honest. You have to make kind of an active choice every day to say, we're doing this for the love of the game, if you will, because you could certainly make more money doing corporate medicine sometimes. So that's awesome that y'all do that. And it's always good to talk to business owners. Again, harder and harder to find. I don't know about Gretel, but I want to one day buy out an existing clinic. So that's a goal of mine. I love hearing about it. I love that y'all tied in the business decisions. Yes, gold standard, but also we do have to run a business. Not everything can be free, unfortunately. All right. Well, thank y'all so much for joining us today. Yeah, thank y'all.